Sawasdee Krap and good afternoon. Today is Monday, the 11th of January 2021, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or CCSA. So first and foremost, the spokesperson had mentioned that for some days during this week, he might have to be on official duty inspecting the public health facilities and situation in certain provinces in the northeast of Thailand, Isan area. So therefore, there might be a relay of on-site information from those areas on television as well. But in any case, of course, the English language broadcast will continue to summarize the situation for the English language audience viewing here in Thailand and on social media from around the globe. So just some recap, the spokesperson mentioned about the global numbers today. It has reached almost 90 million infections globally already, which is quite alarming. For the number of deaths around the world, it's almost at the point of 2 million. It's 1.9 million fatalities, wherein one country has been faced with fatalities of up to 300,000 fatalities, the top countries on this list. Luckily, in Thailand, we have been able to treat the infected persons who have been traveling to Thailand or live in Thailand. And the deaths toll remain at 67, which is very low compared to other countries proportionately and in relation to population as well. And Thailand remains at the 128th rank around the world. So for the number of cases that we have for today, there's a slide up for you today. I'd like to present this in a reverse format just for a change. Firstly, look at the green box you see on screen. The number of total recoveries that we have for today is 6,566. This is actually more than half of the number of cumulative cases we have in Thailand. So the number of cases we have in Thailand, more than half, well more than half, have recovered. So that speaks something for the strength of our public health system, which I'm very happy to say this. So starting off with that in a reverse form. For today, new recoveries, we have 138. The cumulative total number of people recovered, discharged is 6,566. That's a very good number, because the total number of cumulative cases in Thailand is over 10,000, as we mentioned yesterday, 10,547. So well more than 50% have recovered, and we're hoping that the green box will take over the number in the red colored box very, very soon. For the cumulative number of cases, 10,547, that already includes the new confirmed case that we have for today, which is 249. It's been in the 200s for a couple of days now. Out of this number, 249, 176 cases are from local transmission, 48 cases from active case finding, 11 cases from those found in state quarantine, and 14 cases from those who have just arrived from abroad. So if you do the math, we actually have less than 4,000 people currently in treatment, 3,914 in treatment. So hoping that this number will be joining the number of people who have recovered very, very soon in the green box, and no additional fatalities. So just some observations from the briefing of the spokesperson just now. For the general overview, we can notice that although the number of new cases seem to be stable at 200 plus per day now, these numbers cannot fully be trusted, of course, because we still have a lot of work to do in terms of active case finding. The factories, the number of workers in Samut Sakhon are in the hundreds of thousands. The factories in the hundreds, the workers in the hundreds of thousands. And this active case finding in Samut Sakhon in this area is focused on the factories, which we will continue to do that on a daily basis. So we cannot trust the numbers and that they won't increase. Okay, we don't know yet, but hopefully we hope that 200 per day will be decreased on a daily basis to 100 and the like. The spokesperson, before going into some information that is useful for the English language audience, I'll recap also the Q&A portion of the spokesperson just now. He addressed some of the inquiries. One was from the Thai PBS channel station, wherein the question was that the private sector was interested in joining or collaborating with the government sector in terms of in building more field hospitals in that project. And of course, the government side is very appreciative of that. It's a very good proposal. It will actually expedite and make the construction of newer field hospitals even faster. And of course, in these field hospitals, we utilize various measures and techniques to be able to check on COVID for the people in the field hospital, including we utilize the pool saliva sample technique as well in these field hospitals. So that's a very good initiative, very good proposal from the private sector, and we will be looking into cooperation with the private sector. Another question was about the risky area, gray, dark activities, vice, and all these things. The question was particularly about illegal congregation, illegal meetings of people who meet to take drugs, just simply put. These are very, very risky, and they can actually become a new cluster in themselves. So this can be a cluster just like the way that gambling dens and other gray type of activities have already been proven to be new clusters of the spread of COVID. So we've addressed the gambling dens, and of course, drugs is illegal, illicit drugs. That's something that the enforcement authorities are putting a focus on, because not only are they illegal, but they can also be a new cluster. So therefore, please avoid all dangerous activities, vice activities. Look into your personal hygiene. Many activities will actually are actually risky for your personal hygiene and the group of people that you meet. So therefore, we have to put an extra attention on that, especially on gray area activities, illegal vice activities. So just some pieces of information that might be useful to the English language audience. First is this general analysis of the tendency of the current wave. Yesterday, I gave a summary of research report and analysis from the Ministry of Higher Education, Innovation, Research, and they had made a good research and analysis on the 363 days since we learned about the first COVID case in Thailand in January of last year. 363 days later, which I think was the 9th of January, it was the day that we found the 10,000th patient in Thailand, 10,000. And that was analysis yesterday. But for today, just some additional information for today, that on the overall development of the situation, the analysis conducted by the Health Ministry now suggested that the current wave of COVID may likely slow down within 2 weeks or by the end of January. Now, I mentioned that the numbers cannot be trusted, but if by chance the numbers have a trustworthy meaning in themselves, if the numbers would mean anything, if the numbers are lower each day, if this trend continues, most likely we'll have a slowdown of this outbreak within 2 weeks or by the end of January, hopefully. The data collected by the Disease Control Department indicates that 19 provinces in the country are still COVID-free since the beginning, since last year. 19 provinces are provinces which have not found any COVID case at all, and they have had no active cases since the beginning of last year. Another number, aside from the 19, is 21. Another further 21 provinces have recorded no cases of the virus in the past 7 days. So that's good news. That's why the numbers are sort of like stable, but we cannot trust them 100%. So 21 provinces, no new case in the past 7 days, a very good and positive sign. Hope that we can report to you that the 19 provinces that are COVID-free remain COVID-free forever, and hope to report to you that the 21 provinces with no virus in the past 7 days, the number will expand. I hope that tomorrow we'll be able to say 30 or 35 provinces with no cases in the past 7 days. The decrease in the number of new cases is due to the effective action of the control measures we have by many provincial administrations and the cooperation from the public, of course. To achieve the goal of overcoming this second wave, this new wave, CCSA advises members of the public to continue to strictly observe the guidance, avoid crossing provincial borders, traveling inter-province unless necessary, if possible, and closely follow the local regulations and restrictions and measures. And we had some images shown to you on screen on the work of the authorities in different provinces and here in the government as well. Another interesting part of the information that we have is the situation update in Samut Sakhon province, wherein yesterday, it's interesting to learn that almost 300 Myanmar migrant workers have been discharged from the field hospital in Samut Sakhon, which was the first large group that had been discharged from Samut Sakhon to have recovered from COVID, and there will be more patients in that cluster to be discharged soon. So an update on that, because the authorities have facilitated them as well in their commute return, the return back to the area that they reside in, live in the Central Shrimp Market area. They've also been issued COVID-free certificates to ensure their health status, which would allow them to return to work in the future. However, Samut Sakhon province remains committed in conducting active case findings continuously. As I mentioned, despite the new number of cases as not as high as in the past few weeks, hopefully stable, the province is prepared to accommodate more patients in the 2 new field hospitals that we have already now being set up, which are expected to be in operation within this week. And just some heartwarming images, that image that you see here on screen of foreign migrant labor, some of which may have been discharged and been treated very well by the health authorities in our health system. And I'd like to urge, of course, all healthy members of the public to consider doing one thing as well, donating blood. Yesterday, the Thai Red Cross Society issued an urgent appeal for blood donations as supplies across the country are running critically low. The Red Cross revealed that the amount of blood being donated has fallen by almost 50% as a result of the new COVID infection, the new wave, which also caused the mobile blood collection units, the blood collection buses, to suspend their operations. So these blood donations can still be given at the National Blood Center of the Thai Red Cross Society. In Bangkok, it's at the Ongri Dunang Road and also in Bang Khae district, and various centers as announced by the Thai Red Cross Society. And those who wish to donate blood are asked to reveal the status of their travel, the status of their health, their recent travel history, of course, especially any recent visit to high-risk places. Otherwise, they would be suggested naturally to postpone their blood donation. So just in closing, I'd like to make this opportunity to once again thank all Thai citizens, all foreign friends who call Thailand home, who have downloaded Mo Chana application, which is now has been downloaded almost 4.4 million times already. Yesterday, the new download number was 1.5 million, in addition to those who already downloaded. So the total we have now is around 4 to 5 million users nationwide. Personally, I have used the application and can assure you that it's totally efficient, of course, cost-free, efficient, effective in position tracking, not intrusive, and would be very supportive of the work of our health personnel who have been working hard to keep our numbers in Thailand low and not increasing. This would support the disease control efforts of all authorities and relieve the workload of our medical personnel. And I'd like to thank you for your attention today. We gave you a recap of the Thai language version of the briefing and some information that would be useful to the English language audience. So once again, I'd like to remind you that the information in English can be found on our social media platforms, be it the provincial measures in the TAT News platform of the Tourism Authority or the MOI COVID, the CCSA Facebook page, and all the other news outlets available to you and updated to you constantly throughout the day today. So this is all I have for today, and thank you very much. Hope you all stay safe and stay healthy, and we will see you again tomorrow as always. Thank you. สวัสดีครับ